Thank you, and thank you, Praveen, for the invitation. Yeah. So I'm from Sao Paulo, no disclosure for this talk. I'm from Nuclear and Energy Research Institute, where we build lasers for our own use. There's a group of doing industrial application of lasers, laser-induced detector and range, because São Paulo is a very polluted area. We have systems on Amazon controlling the burn of the forest, and there is this biophotonics. This is my own group at the moment. To the left, people from hard science, most physicists working with diagnosis of cancer as our main present collaborators. The left side in dentistry, left side in tumor diagnosis by FTIR imaging. So erosion and caries prevention can be reached in several ways using lasers. In this case, I'm just showing how to remove caries from the beginning of the 90s. How do you get to this clinical use? So we have this 32 years cooperation with dental school, with Carlos de Paula Eduardo, and our first project together was to build and to test a home laser built at our place. And then we learned that for other proposals, we have to take care about the absorption wavelength, depending what you want to reach. So erbium lasers and CO2 9.3, 9.6 are very good to ablate tissue and also to treat tissue, but neodymium laser can be interesting because all of them can change the crystallinity properties of the hydroxyapatite. We see OH absorption and phosphate absorption are here, and OH in water as well, so high intensity absorption of these wavelengths for the water and also hydroxyapatite. So we have also take care about the heat generation. So heat generation due to irradiation is very important, and for that we have to remember a little bit of the basics, because heat is generated after the absorption of the photons by using, for example, this diffusion theory. We know that absorption is related to absorption as well as scattering and the angle of light propagation. Whoops. So just to mention that in solid like hydroxyapatite from enamel or dentine, so we are, what the heat means, we can change the structure, and we can also evaporate it if we get ablation. And we have to remember that the heat propagates much further than the optical absorption thickness. It means that if the photon is just absorbed in a thin layer, the result of the heat generated by that absorption can cover a very large volume. So you may change the structure of a larger volume deeper than the photon penetrations. In non-ablative lasers, like neodymium laser, we can have melting and resolidification of the surface, very useful for example, hypersensibility treatment, but that can be used, we can use also ohmium YAG or YLF laser to do the same. For example, hypersensibility, I've been a patient, the only time I've been laser patient in dentistry was to treat hypersensibility. It took about 20 years or more to rebuild the surface again with lasers. So it really lasts the treatment. So CO2 9.6 we also can have melting in the surface. This was acid after the treatment, and the laser area didn't got the same loss of material as the acid in non-treated part. So erosion, as you know much better than I do, is a loss of material by a chemical process with no microorganism involved. So normally it takes place close to the gums, where the non-cariocervical lesions also are there. So we have a small experience on that. Have a recent publication showing that optical coherence tomography imaging and as well FTIR, ATR spectroscopy show us that the reduction or carbonate content of the enamel will also change during the demineralization processes, and the laser will protect this treated layer very well, preventing the erosion to continue. So as the thermal interaction is just out of the place, we are choosing the best laser. We have tested erbium chromium YSTG as well, neodymium YAG laser for the caries prevention. We always take care about how the heat is diffused through the tissue. You use always a thermal camera and very thin thermocouples to have a response. For example, in this case, we have irradiating a molar with one of our pre-setting conditions, using a coal to protect the surface, because with coal layer we can keep the heat in smaller amount of temperature variation. And then we see here, when the laser stops, the heat continues to propagate much beyond the absorption layer in erbium. That will be a few micrometers. Instead, the heat propagates through several millimeters. So in order to know what would happen to the pulp during irradiation, we use a thin thermocouple. They are 127 micrometers. I know Omega launched 50 micrometers. We are going to test to see the temperature inside. Resolution time is very small, a fraction of a second. And if we use, like most of the papers in the literature, thick thermocouple, their mass will take long to detect the temperature, and we will measure a wrong number. There's plenty of papers out there with, well, discussable temperature measurements. So as the pulp temperature can change, looking to the time, we can see, for example, without absorption, comparing with absorption, the highest temperature was reached for 8.5 joules per centimeter square with erbium YSTG from BioLase. And here we can see too high temperature, but the same with coal layer on the surface of the teeth is the blue one, which very less temperature, lower temperature. So we tested several conditions. So in this case, is inside the pulp. Okay, so all of them are below the Zach and Cohen traditional paper to the safe of the pulp, saying that the limit was not reached for none of them. We can see the difference between the cold reduced the heat transmission. So we published there 20 years ago. And for this work, we only made a not clinical study yet, but we cover all chemical and temperature measurements, and we could be done. So we are saying that there is a potential for prevention, considering that the water and carbonate loss began at 100 Celsius degrees, and we have in these conditions temperatures above that. That is an average temperature outside the teeth, not inside, as I have shown previously. And in this case, for example, we are seeing that the coal reduced the heat transmission. Of them are below the threshold of temperature in the pulp, which means safety. And then we tested a little bit of YAG as well, neodymium YAG. So just to show how it's the appearance of absorption graphic of the dentin, for example. So we see the same components as enamel, but with much more organic compounds in here. So we have water, carbonated, and other organic materials, as well as phosphate. So if we increase the energy density in this case, we can take the water to zero in the irradiated surface, for example, and you will for sure decrease all the other organic materials. And while phosphate, you decrease a little bit of its amount, but it's quite much more stable. Okay, so we were also able to calculate another physics stuff, like to understand how hard it is to take the structural water than the absorbed water from some specific tissue. And using erbium chromium YSGG laser, we made several tests of caries in vitro, so this mineralization, remineralization cycling. And then we show that it's the group that where we associate phosphate with the laser irradiation had much less volume of mineral loss. But why it happens? So we went to the synchrotron facility and we measured the crystal. For example, using ohmium laser, we add to natural phase of hydroxyapatite tetracalcium phosphate. With neodymium YAG, we add a 3-calcium phosphate, and with erbium YSGG, we also add to the natural phases the tetracalcium phosphate. Besides that, we enlarge the crystal diameters, making the space for the acid metabolic from the bacteria not to enter. So after all these tests, we did a clinical study together with the dental school, Professor Carlos Eduardo, with using 100 patients and, previously determined conditions of irradiations, okay, and control it. We cause melting in the surface of occlusal part of the teeth. So just the coil, irradiation, and after that we use together the fluoride. And to conclude this, the prevention was 38% after 12 months with a few amount of white lesions. We called lesion any kind of lesion, caries, white lesion, but we calculate directly that will be 68% prevention over daily brushing with fluoride toothpaste. So that is also a long time ago, and to finish just in time. We have a couple of books, well, specifically 2 of them. That one is just launched. It's OCT in dentistry. I'm also an editor and author of a couple of chapters on that. It's on Amazon and so on. It's from Taylor and Francis. That's my present and previous group, so I would like to thank those who make the hard work in the lab and those agencies who finance our works over the time, and just to make something that we should not forget to give toys related to science to our girls as well. Okay, so thank you very much.